Welcome to this presentation on quality management and improvement. In this session, you'll learn some of the important organizations and agencies that oversee quality assurance in the laboratory and govern regulations that ensure delivery of safe, accurate, and timely test results. You'll also learn the process that has been put in place to ensure procedures are continually improving. Finally, you'll be introduced to some of the components of a quality assurance program and identify areas where quality control is performed. Here's a list of the topics we'll be covering and the slides on which you'll find them. We begin with slide 4, QA/QC in the laboratory. Slide 5 is quality management systems. Slide 6 covers laboratory workflow. Slide 7 is on quality management. Slide 8 to 9 covers areas of phlebotomy that are subject to QA. Slide 10 to 13 covers documentation. Slide 14 to 18 is QC areas of phlebotomy. And finally, slide 19 is QC in the core laboratory, lab testing. What are quality assurance and quality control? That's a big question. Quality assurance is the process to ensure the quality of a product or service, in this case, lab results. It refers to processes used to create standardization for quality service or product and is designed to prevent future problems by evaluating past and present performance and then using this data to refine lab standards and procedures. Healthcare facilities continually gather information and assess negative impacts and then use that information to improve quality of care provided to patients. Examples of areas that can be improved upon are accuracy, reliability, and timeliness of reported test results, known as turnaround time or TAT. You can see here that quality indicators, threshold values, incident report forms, quality control, and various lab manuals all fall under the umbrella of quality assurance. Quality indicators are measurements that monitor all areas of patient care that tend to be problematic to provide information about quality of procedures. Quality indicators are triggered when a threshold value is exceeded, indicating a problem needs to be investigated. For instance, if the blood culture contamination rate threshold or the specimen recollection threshold is set at 3%, as soon as there are more than 3% contaminated blood cultures or more than 3% samples that need to be recollected due to collection errors, the threshold value is exceeded, and this is a quality indicator that it needs an investigation using an incident report form, which will be covered in more detail in a later slide. Quality control, or QC, falls under the umbrella of QA, and it refers to specific activities and techniques that are performed to confirm that you're delivering quality results. This is done by ensuring that current procedures are working and to detect problems and fix them before any results are released. QC is done to check that procedures, equipment, or reagents are working correctly before using them. And QC finds problems in the current process that result in poor patient service or lab errors, like expired tubes, fridge and freezer temps that are too high or too low, and daily controls are run on analyzers to ensure they're running correctly. Lastly, there are various lab manuals like the reference manual, the user or procedure manual, and the safety manual, and others, which we'll talk about soon. The national organization that sets the standards for phlebotomy procedures is CLSI, or Clinical and Laboratory Standards Institute. It's a nonprofit organization dedicated to fostering excellence in laboratory medicine by developing guidelines and standards for all areas of the laboratory, including phlebotomy. This slide shows the laboratory workflow. Pre-analytical means everything before analysis of the sample, including preparing the patient for sample collection procedures, and specimen handling, such as receiving, accessioning, centrifuging, and aliquoting the sample, and dispatching it to various departments or sending it out to other labs for testing there. This is our area of expertise, and is our responsibility to ensure it's done accurately according to specific guidelines. Analytical involves all laboratory testing, which is performed by laboratory technologists, and post-analytical includes the reporting of results and record keeping. It is very important that we follow the correct steps when collecting blood. If mistakes are made during the collection procedure, it can lead to inaccurate results. The consequences of collecting poor quality samples or making labeling and handling errors include some serious treatment complications, from unnecessary or inappropriate treatment to failing to provide the patient with the treatment they need. Errors can also result in delays in establishing a correct diagnosis and unnecessary repeat testing if mistakes require sample recollection. Some factors to ensure quality in phlebotomy include specimen collection and handling policies and procedures based on CLSI guidelines with strict adherence to guidelines, skilled, trained, competent, and professional lab staff, continuing education, and quality control procedures. There are many areas of phlebotomy that are subject to quality assurance, areas that are monitored to prevent future problems. These include our response time for inpatients in a hospital setting, patient waiting time for outpatients, the total time required for completion of the phlebotomy procedure, the percentage of successful blood collections taken on the first attempt, the number of successful collections requiring a second attempt. Note that the maximum number of attempts a phlebotomist has to obtain a blood specimen is 2 times. The volume of blood loss per patient due to venipuncture collections, the number and size of hematomas due to poor collection technique. A hematoma is blood pooling under the skin that forms into a 3D bruise. And the number of patients who experience syncope or fainting. Continuing on the list of phlebotomy areas subject to QA, we monitor the number of redraws requested because of inadequate specimens, the number of patient collection errors investigated. Many of these errors can be detected using a delta check. A delta check is a quality control tool that involves the comparison of lab test results with results obtained on a previous sample from the same patient. For instance, if a hemoglobin result was 100 grams per liter in the morning and 180 grams per liter in the afternoon, the second result will fail the delta check. Hemoglobin cannot be made in the body this quickly, so one of the results was erroneous, and both will require an investigation. We monitor turnaround times, TAT, of certain designated lab results. The number of incomplete forms, documents, or logs in the lab. The number of therapeutic drug monitoring or TDM tests that have incorrect documentation or timing. Remember that they must be drawn within 15 minutes of the specified time. Otherwise, the drug will be metabolized and will not be at the expected level when the sample is drawn. We monitor the number of specimens that were drawn in the incorrect tubes. Contamination rate for blood cultures due to improper skin antisepsis technique. We look at results of patient satisfaction questionnaires or focus groups and the frequency of patient complaints. There are certain documents in the lab that are kept for extended periods of time for legal reasons. The patient's record, which is a chronological documentation of medical care given, is required by law for hospital and private lab patients. Every notation should be legible, precise, and complete. For the lab, that includes every test ordered, collected, and resulted, as well as a record of any blood products a patient receives. The purposes of this documentation are to aid in the practice of medicine, to facilitate communications between healthcare providers, to serve as a legal document which may be used in court, or to help the hospital during quality assurance processes to evaluate performance outcomes. There are some QA documents in the lab which are essential for phlebotomists, including the online test catalog and reference manual, the lab procedure manual, the safety manual, the infection prevention and control manual, and various QA forms. We'll cover each important QA document in the next few slides. The first one we'll discuss is the online test catalog and reference manual, which details how to prepare the patient for collection and other special collection instructions. As a phlebotomist, if you have a specimen-related question about how to collect a lab specimen and there's no one to ask, this is your go-to reference. The online test catalog and reference manual has detailed information regarding patient preparation and collection procedures to ensure you're collecting quality samples. These include tube and sample type, optimal and minimum amount of specimen required, transport temperatures like keep at room temperature or place on slurry water or place on heat block, special handling requirements such as full draw, no microclots, or do not spin, normal turnaround time, and specimen rejection criteria. The next QA document is the Laboratory Procedure Manual, which states policies and procedures for each test or practice, including how to test the sample, how to report the results, when to reject unacceptable samples. It must be made available to all lab employees and must be updated at least annually. The next QA document is the Safety Manual. It contains procedures related to chemical, electrical, fire, and radiation safety, exposure control, disaster plans, and handling hazardous materials. The next QA document is the Infection Prevention and Control Manual. Considering the emerging infectious diseases, drug-resistant organisms, and hospital-acquired infections, infection control measures are more important than ever. This document contains information about hand hygiene and other decontamination procedures, precautions when dealing with patients or handling specimens, and procedures to implement following incidents of exposure to infectious material. The last documents for discussion are QA forms. These include equipment check forms used to document maintenance and to record temperatures, and internal or incident report forms. These forms are filled out when any problem occurs in the lab. The purpose of the form is to 1. Identify the problem, 2. State the consequence, and 3. Describe correction. So for instance, 1. Identify the problem. Let's say, for example, the phlebotomist collected a sample from the wrong patient. 2. State the consequence. In this case, it would mean that erroneous results were reported, which could lead to improper patient treatment. And the sample would need to be recollected on the correct patient, leading to delays. The corrective action, maybe the phlebotomist needs to be retrained in the correct ID procedures. Incident report forms should state facts and not feelings. And note that it is not the MLA's responsibility to suggest new guidelines. This is the responsibility of the supervisor or the manager. Now let's discuss quality control as it relates to phlebotomy. Quality control is important during patient preparation procedures. Some tests require that the patient be fasting. If the patient is not fasting, this will affect the test values since glucose and other analyte values will be higher. So it will need to be documented that the patient was not fasting. Sample collection instructions for non-blood specimens are explained to the patient in detail so the patient collects it properly and repeat testing is not required. There may also be special timing issues for tests such as blood glucose, therapeutic drug monitoring, and hormone tests. Quality control is also crucial during collection priorities. Specimens should be transported to the lab in a timely fashion to maintain viability. Remember STAR. S stands for STAT. STAT requests must be drawn immediately or within 15 minutes of the time it was ordered. T is timed tests, which must be drawn within 15 minutes of the specified time of collection. A, or ASAP, or urgent, means a sample must be drawn within 30 minutes of the time of request. And R is for routine. Routine samples should be drawn within 45 minutes or on the next rounds in hospital settings. The lab must keep a list to document specimens that are delivered to the lab after the designated time limit to help detect the source of the problem and take corrective action if necessary. Another critical QC area for phlebotomy happens during patient identification. The phlebotomist must always accurately identify the patient. Misidentification of a patient can result in an erroneous cross-match and transfusion reaction, which could be fatal to the patient. You must actively involve the patient in their own ID. Always ask the patient to spell their last name, state their date of birth, and then look at the armband to confirm this and the hospital ID number. Some hospitals use barcodes, but this does not replace verbal ID. QC for venipuncture techniques includes improper needle selection. Insertion or excessive probing could result in nerve damage or severe pain. Probing is when you miss the vein and make very blind insertions to find the vein without feeling for it first, and should never be done. Another area subject to QC is the type of sample required. Blood tests might require serum, plasma, or whole blood. Other tests might require urine or stool. Microbiology testing deals with a variety of sample types, so specific information as to what's required for the test is needed. Submit only acceptable sample types listed in the reference manual. Otherwise, it will be rejected when it's received in the lab. Also, type of sample container or tube. The container for the sample is very important, as it will affect volume and any needed additives such as anticoagulants, additives, and preservatives. Collect all samples according to the correct order of draw to avoid cross-contamination and carryover of tube additive. Ensure you're submitting them in the correct tube size and that micro containers are filled to the minimum volume required to ensure adequate volume for testing. Allow the blood to clot for the specified clotting time to avoid interfering substances, and collect using the correct tube additive to ensure sample stability. Non-blood specimens require specific transport media to preserve microorganisms. Some other areas of phlebotomy subject to QC include sample handling. Labeling requirements must be met for labeling 100% of the time. All information must match, letter for letter, number for number. Labeling the sample at the time of collection at the patient's bedside. Imagine if you didn't label the sample immediately and then got called for a stat and drew that sample before labeling the last sample. Would you know which tube belonged to which patient? More areas of QC in the lab include special handling or specimen integrity. Some samples may require special handling and considerations such as immediate refrigeration, room temperature, slurry water, heat block or water bath, protection from light, avoiding contamination such as with IV fluid or ports and catheters. Specimens should be handled carefully so as not to damage or hemolyze the sample. The last area of QC for phlebotomy includes equipment, charts, safety, infection control, cleaning, and maintenance. Hand hygiene is required after each and every patient. This is the most important technique to prevent the spread of infection. Using universal standard precautions. Treat everyone the same. It means treating every sample as if it were infectious, not only samples that are known to be. Using the sharps and biohazard containers appropriately and disposing accordingly. Supplies and equipment. Ensure that needles are sterile and that the seal is not broken, and maintain sterility after opening the needle. Check for needle defects. Expiry dates should be checked on every tube. Proper PPE should be worn when required. All equipment maintenance should be performed daily or as required. Clinical alert. Inappropriate cleansing techniques or hand washing could result in transmitting nosocomial infections or hospital-acquired infections, HAIs. Lastly, we'll touch on some other QC areas in the lab affecting MLAs. This time we'll talk about the core lab or the testing lab. In the lab, some analytical variables influence minimum blood volume requirements. They include analytical instruments that require a minimum volume to aspirate for testing, or may require a standard test tube size to function automatically. Special handling procedures are needed for separating plasma or serum into sample aliquots for testing in different areas of the lab, or for sending to a reference lab. And finally, volume requirements by the tube manufacturers to ensure adequate dilution with an anticoagulant or other additive. Please take a moment to review the following concept questions. Question 1. Which of the following are set up to monitor all areas of care that tend to cause problems? A. Internal report forms. B. Quality indicators. C. Sentinel events. Or D. Threshold values. Question 2. A phlebotomist in a hospital laboratory receives 4 orders to collect blood at the same time. Select the sample that he or she should collect first. A. A request for a routine PT in ECU. B. An urgent request for a CBC in MAT. C. A stat request for CBC in the ER. Or D. A timed test for glucose in ICU. Question 3. A national organization that sets standards for phlebotomy procedures is the A. ASCP, B. NACLS, C. NCA, or D. CLSI. Question 4. Blood culture contamination is a quality indicator for A. Environmental Services Area, B. Infection Control Area, C. Microbiology Department, or D. Specimen Processing Area. And the answers are: which of the following are set up to monitor all areas of care that tend to cause problems? The answer is B. Quality indicators. Quality indicators are just that, indications that there may be a problem. They're triggered when a threshold value has been exceeded. For instance, if sample rejection and recollection rates exceed the 3% threshold value, this is an indicator that something is wrong and needs to be investigated. Question 2. A phlebotomist in a hospital laboratory receives 4 orders to collect blood at the same time. Select the sample that he or she should collect first. The answer is C. A stat request for CBC in the ER. Remember STAR. Stat, timed, ASAP or urgent, and routine. Stat must be collected within 15 minutes. Timed must be collected plus or minus 15 minutes of the established time. ASAP or urgent must be collected within 30 minutes. And routine must be collected within 45 minutes or on rounds. Question 3. A national organization that sets standards for phlebotomy procedures is the answer is D, CLSI, or Clinical and Laboratory Standards Institute, which dictates many procedures that must be strictly adhered to ensure you're collecting quality samples. Question 4. Blood culture contamination is a quality indicator for? The answer is C, Microbiology Department. Blood cultures are tested in microbiology, even though MLAs collect them. And the microbiology staff are the ones who monitor false positives and investigate whenever that percentage exceeds the threshold value, which is usually at 3%. During their investigation, they'll look into issues like expired or contaminated blood culture bottles or improper collection technique, like failing to do the proper skin antisepsis. Concept check questions continued. Case study. An MLA receives a request to collect a stat CBC in the ICU as the patient's condition is rapidly deteriorating and requires emergency surgery. The atmosphere is hectic, but the patient is coherent and answering questions the nurse is asking him. Trying not to get in the way, the MLA quickly checks the wristband hanging from the IV pole to confirm the patient's ID, draws a sample, and returns to the lab. When the CBC is tested in the lab, the RBC count was much higher than those from the CBC results collected during morning rounds that morning, and it failed the delta check. Question 1. What mistake did the MLA make? Question 2. Why did the sample fail the delta check? Question 3. What are the implications to patient treatment? And the answers are: Question 1. What mistakes did the MLA make? The MLA did not involve the patient in the identification process. Since the patient could communicate, the MLA should have asked him to verbally ID himself by spelling his name and stating his date of birth and confirming it matches the wristband. Even if the patient was unconscious, verbal ID still needs to be provided by a nurse or other caregiver. The MLA also used a wristband that was not attached to the patient, but to the IV pole. Answer 2. Why did the sample fail the delta check? The sample the MLA just collected was drawn from the wrong patient. What are the implications to patient treatment? This patient may not have received the proper treatment he required. For instance, the patient's RBCs were low and the patient required a transfusion, but the false high RBC count gave a false indication that the patient doesn't need a transfusion. This could have serious or perhaps fatal consequences for the patient. To summarize quality assurance in the laboratory, the Clinical and Laboratory Standards Institute, or CLSI, sets guidelines and standards for all areas of the laboratory, including phlebotomy. Quality assurance, or QA, is the process designed to prevent future problems by evaluating present and past performance, and then using this data to refine lab standards and procedures. For example, preventing specimen collection errors, preventing high blood culture contamination errors, and preventing long turnaround times by writing procedures to prevent them and training staff how to avoid these errors. You can see here that quality indicators, threshold values, incident report forms, quality control, and various lab manuals, including the procedure manual listed here, all fall under the umbrella of quality assurance. Quality indicators are measurements that monitor all areas of patient care that tend to be problematic, to provide information about the quality of procedures. They're triggered when a threshold value is exceeded, indicating a problem that needs to be investigated. For instance, if specimen recollection threshold is set at 3%, As soon as there are more than 3% of samples that need to be recollected, the threshold value is exceeded, and this is a quality indicator that the problem requires investigation using an incident report form, which is the form used to identify the problem, state the consequences, and describe corrective action. Quality control, or QC, is a component of quality assurance and includes various activities performed to ensure that current procedures are working and to detect current problems are fixed before any results are released. QC uses checks to ensure that procedures, equipment, or reagents are working correctly before using them, and QC finds problems in the process that result in poor patient service or lab errors, like expired tubes, fridge and freezer temperatures that are too high or too low, and daily controls are run on analyzers. Lab manuals such as the user or procedure manual, reference manual, and safety manual are all lab documents that are used in the lab. The procedure manual states lab policies and procedures performed in the lab and must be available to all lab workers. It's a good resource, especially when working alone, since doctors and nurses are no help when it comes to lab procedures. This slide shows the quality assurance implications of the various specimen collection errors and the reasons why specimens need to be rejected. They include the sample not being adequately mixed, causing microclots, which will cause a CBC to be rejected. Patient ID error, like collecting from the wrong patient. Tube mislabeling error, spelling the name incorrectly or placing the wrong label on the wrong tube. Sample collected in the wrong tube, like a CBC collected in an SST tube. Contaminating the sample with IV fluid. A transport delay causing glycolysis or specimen degradation. Sample timing errors, like a therapeutic drug monitoring not collected within 15 minutes of the specified time. Using expired tubes that don't fill correctly, or the additive has become ineffective. Not collecting enough sample for testing. Not collecting full tubes when full draw is required. Incorrect handling, like not placing on slurry water or heat block, or protecting from light if required. Patient not fasting for tests that require a fasting patient. CBC sample centrifuge, which destroys white blood cells. I'm sure you now have a better appreciation of the importance of collecting quality samples in the lab and the quality assurance implications if not accurately following the established standards and procedures. It has been my pleasure to educate you on these very important issues. Thank you. That brings us to the end of this presentation.